इनकी दूरदर्शी दृष्टि, अथक सेवा और वैद्यों को एकत्रित करने की भावना से हुई थी। आज उनका नाम महाराष्ट्र ही नहीं, पूरे भारत देश में संगठन, सेवा और आयुर्वेद प्रचार के प्रतीक के रूप में लिया जाता है। सच्चे आयुर्वेद को समझना और नए वैद्यों को सिखाना ही वैद्य भरत कुमार जी का प्रमुख उद्देश्य था। इसी कारण उन्होंने वैश्विक गुरुकुल के माध्यम से स्वयं लिखित 5 पुस्तकें प्रकाशित की। हमारे कार्य और उद्देश्य: गुरुकुल परंपरा के मूल्यों को पुनर्जीवित करने, जनरल प्रैक्टिस करने वाले वैद्यों को पुनः शुद्ध आयुर्वेद की ओर मोड़ने, नववैद्य पीढ़ी को सच्ची और गहन आयुर्वेद ज्ञान की ओर आकर्षित करने, समाज के अंतिम व्यक्ति तक आरोग्य और आत्मनिर्भरता पहुंचाने के कार्य में सक्रिय है। वैश्विक गुरुकुल एक व्हाट्सएप ग्रुप ऐसा भी है जो राष्ट्रीय स्तरीय अद्भुत आयुर्वेद कार्यों को निरंतर आगे बढ़ा रहा है। वैश्विक गुरुकुल परिवार द्वारा राष्ट्रीय स्तर पर विचार गोष्ठियां और संगोष्ठियां भी समय समय पर आयोजित किए गए हैं, जैसे श्री गुरु स्मरण, रुधिराग्नि, वैद्य भरत कुमार आयुर्वेद सेवा महोत्सव, विशेष आरोग्य कैंप्स एवं व्याख्यानमालाएं, फ्री ऑनलाइन आयुर्वेदा वेबिनार्स। इसके बाद गुरुकुल औषधि भंडार की स्थापना हुई, जहां शास्त्रों और ग्रंथों में वर्णित पद्धति से तैयार की गई औषधियां, सभी प्रकार के सिद्ध घृत, तैल, शतावरी कल्प, विशेष रूप से बस्तांड घृत, मज्जा तैल, वजेड़ी घृत, अस्थि मज्जा पाचक घृत जैसी औषधियां गुरुकुल औषधि भंडार के माध्यम से वैद्यों को अत्यंत प्रभावी रूप से वितरित की जा रही हैं। हमारे गौरव पुरस्कार: हम हर वर्ष आयुर्वेद क्षेत्र में अतुलनीय योगदान हेतु 2 विशिष्ट राष्ट्रीय पुरस्कार प्रदान करते हैं। राष्ट्रीय आयुर्वेद रत्न पुरस्कार, आयुर्वेद क्षेत्र में उत्कृष्ट योगदान हेतु। राष्ट्रीय रणरांगिणी पुरस्कार, स्त्री आयुर्वेद वैद्यों के समर्पित कार्य हेतु। 19 मार्च 2021 को हमारे वैश्विक गुरुकुल परिवार के प्रमुख, आयुर्वेद व अध्यात्म के गहन अभ्यासक वैद्य भरत कुमार जाधव जी का दुखद निधन हुआ। धन से ज्यादा सेवा को महत्व देने वाले भरत कुमार जी गुरुकुल को ऊंचाइयों तक ले जाना चाहते थे। वे अपने लिखे हुए विचारों और योजनाओं से ये सपना साकार करना चाहते थे, लेकिन नियति को कुछ और ही मंजूर था। आज भी वैश्विक गुरुकुल की टीम उनका सपना साकार करने में जुटी है। उन्हें दिल से सलाम।
हमारे बीच उपस्थित हमारे अतिथि वैद्य रेणु राठी मैम का परिचय देने के लिए मैं चंद्रकांत जाधव सर को आमंत्रित करना चाहूंगी। सर प्लीज।
नमस्ते मैडम। नमस्ते राठी मैडम। आज राठी मैडम को प्रणाम और सभी वैद्यजन को भी मैं प्रणाम करता हूँ। और राठी मैडम को मैं बहुत नजदीक से जानता हूँ, क्योंकि मैं और राठी मैडम एक ही शहर में रहते हैं। और मैडम का काम जो मैंने देखा है वो बहुत पेशेंट के द्वारा ही मैंने सुना है। इसलिए आज मुझ पे जो जवाबदारी है या मुझ पे जो ड्यूटी है वो बड़ी ही कठिन मुझे लग रही है, क्योंकि मैंने देखा हुआ सब मुझे बताना आज बताना मैं चाहता हूँ। तो आई एम वेरी प्लीज टू इंट्रोड्यूस अवर esteemed गेस्ट स्पीकर डॉक्टर रेणु भरत राठी मैडम, प्रोफेसर, head of department and PhD supervisor in the Department of Kaumarabhritta at Mahatma Gandhi Ayurveda College Hospital and Research Center, Salud, Dattamagi Institute of Higher Education and Research, Wardha, Maharashtra, India. With over 24 years of undergraduate and 8 years of postgraduate teaching with PhD guiding experience, Dr. Rathi Madam has mentored more than 40 MDs and 20 PhD scholars. She is a health science educational technology expert and a recognized supervisor in the field of Ayurveda, Unani, and Siddha. Nominated by NCISM, National Commission of Indian System of Medicine. Dr. Rathi Madam holds MD in Kaumarabhritta from NIA Jaipur in 1998 and has pursued further training in bioethics, health education, clinical research, and yoga. She is actively involved in child healthcare research with a focus on Bala Panchakarma, developmental disabilities, malnutrition, and behavioral psychiatry. She has completed over 60 research projects, including funded studies on probiotics, honey detection, and Suvarnaprashan. She started Suvarnaprashan for the first time in Maharashtra in July 2010. With more than 200 publications, 100 plus of them indexed in Scopus, PubMed, and Web of Sciences. Dr. Rathi's contribution to Ayurvedic pediatrics are widely recognized. She has authored a book of Bala Panchakarma and two ebooks on research methodology and biostatics, contributed to 16 books chapters, and holds 16 copyrights. She is a seasoned academic leader and has chaired or presented at over 65 national and international forums. Dr. Rathi Madam has also trained over 20 healthcare faculties in health education methodologies and is a mentor, reviewer, and advisor across multiple institutions and journals. Her work exemplifies a deep commitment to advancing Ayurvedic education, clinical practice, and research. She has started DG Ayur Mastery for research and scientific writing mentorship digitally. Please join me in welcoming Dr. Renu Rathi Madam on this dais. Madam, welcome.
Thank you so much for this detailed introduction of me. First of all, नमस्कार सगळ्यांना आणि वैश्विक गुरुकुल परिवार आणि या आयुर्वेदात्सव मध्ये सगळ्यांची मनपूर्वक स्वागत. मी सगळ्या वरिष्ठ वैद्यगणांना नमस्कार करू इच्छिते आणि सगळ्या ज्युनियर्सना खूप सारं वेलकम की त्यांनी आपली भरभरून आयुर्वेदा प्रॅक्टिस करावी. प्लीज आय विल शेअर माय स्क्रीन जस्ट अ मिनिट. Is it visible?
Yeah, madam.
So today's topic is nutrition-based immunity measures to prevent infections. So we know that childhood period is very crucial to get infection due to high susceptibility and low immunity. So and diet is particularly so much important, and rather Kashyap has given so much emphasis on ahar itself because and it considered as a mahaushad. So we will see in our later slides. The first of all, learning objectives. At the end of the lecture, learner should be able to comprehend basic needs of nutrition, then explain fetal, infant, toddler, and toddler nutrition, and we can again older child and adolescent nutrition also. Clarify the association of immunity and nutrition. Describe nutrition-based immunity measures. Tips to feed baby with congenital problems and in disease conditions. Prevention of infections to boost general acquired immunity. So we will proceed fast because the topic is so vast, and I have got just 45 minutes now because it's 9:15 only, 9:15 already. So we have started with ahar, like it is a Mahabhashajya and considered as a Trayopstambha, one Upastambha in Trayopstambha. And it gives everything: luster, pleasure, intellect, health, life, strength, longevity, etc. Importance of ahar in Acharya Kashyap's words as न च आहार समकिंचित भैषज्याम उपलभ्यते शक्यते अप्यन्नात् मात्रेण नरः कर्तुम निरामयः. So niramay, manusya will be or child will be niramay when child takes ahar in proper way. So Hita Hita Visheshatu Vishesha Sukha Dukkhayoho. So Acharya Charak and so many other acharyas have also explained the importance and emphasis of ahar. Starting with fetal nutrition, we know that mother's diet is very much responsible for proper growth and development of fetus. And placenta is the storehouse and mainly transfers the mother's ahar ras and oxygenated blood supply to fetus, and that's why it releases proteins, fat, and calcium to the mother's blood that can be absorbed through the placenta. And fetus can get proper nutrition through mother. So this is the diffusion method. We can see here by with the help of villi, uh, placental villi, and child gets directly nutritious or we can say oxygenated blood supply from cord. So fetus is totally dependent upon mother for its nutrition, and the various nutritive substances, electrolytes, hormones necessary for the development of fetus diffuse from mother's blood to fetus. Here you can see. So starting with then neonatal nutrition. Soon after birth, neonates awakes, and we can give colostrum within half an hour after normal delivery, and after 4 hours after cesarean section, within 4 hours we can suggest mother to start her breastfeeding, especially colostrum, because we can consider it as a piyush and very important feed, very important diet we can say for the neonate. So no prolactal feed like honey or any jaggery water or nothing can be given, and nothing should be given, and baby put straight to breast and KMC, that is kangaroo mother care letter. Breast milk is a mainly main important feed for every, and it's a right rather of every neonate or every child. So it gives warm food directly and security in the knowledge of her presence. And breastfeeding satisfies all the three and prepare mother for the last trimester for breastfeeding with extra calories in diet. So we need to give around 3000 calories in pregnancy as well as in lactation period. If we see the Lancet paper, we can see here the mainly we can prevent so many mortality with the help of breastfeeding by starting with the within half an hour and within 4 hours after cesarean section. If we continue express breast milking or essential breastfeeding up to 6 months, then we can prevent so many morbidities and mortalities. So in this way, you can see that there are 13% highest rate of breastfeed, whosoever are on breastfeed, they got prevented. They got prevented with the help of other, compared to other macro and micronutrients like zinc, vitamin A, even vaccines, and so many other antibiotics or anti-malarial. So we have to give it and compulsion it to give timely to every neonate. Mainly gestational maturity of 34 weeks, we can mother can or even before 34 weeks also, mother can express her breast milk and give it to nursery to feed the baby. So 2.5 to 5 ml per kg per 3 hours breast milk is mainly to be given, and it is tolerated by the child, by the neonate. And we can see the high rate of prevalence of morbidities and even mortalities under 5 years of age, like 2.4 million is a huge number for mortality in under 5 in India. And 3 major killers in India, particularly neonatal sepsis, gastroenteritis, and pneumonia. And all the three can be prevented with the help of breastfeeding. So every hospital must have baby-friendly initiative hospital policy, which is a total 10 pointers that should be displayed in every hospital, that provokes and that initiates every mother to give the breastfeeding properly. So strategy plan can be started when she came for antenatal checkups and even delivery room. So we can ensure, health professionals can ensure that her nipples are should not be retrogated or any cracked nipples or nothing such problem should not be there. So they can directly treat such conditions before, means antenatally only. And during delivery room also, she has to nurse should remind or doctor should remind her that she has to feed her baby within half an hour in after normal delivery and within 4 hours in post cesarean section. So primary immunization sessions whenever mother is bringing her neonate. So we need to again confirm that she is giving her breastfeeding, and advice regarding weaning, timely weaning, and hygienic preparation of food. So every vaccination should be given timely so that child must be remain safe from all such killer diseases like measles or nowadays it is not killer because we have initiated so much from so many years and decades we have initiated such huge and very vigilant immunization program UIP. So this vaccination catered diseases are not as a killer now, and we can ensure the breastfeeding also and timely weaning also. So feeding schedule, we know that first 3 days Acharya have suggested such Lakshmana Siddha Grut or honey or ghee. But nowadays honey is also not safe, like it may create botulism and all. So we need to ensure that if and Lakshmana is also extinct and it is not, we are not getting it timely, and that's why we can give formula feed if mother is not able to feed the baby within half an hour. Because if mother is already in undernourished and she is not in a position to give her breast milk or rather piyush, which is colostrum. So if we do not give formula feed, then what will happen? Baby may go in hypoglycemia. So we need to put baby neonate to recurrently on her breast. But if still the problem is there, so we have to start formula feed. So we know that colostrum is a piyush and immunity booster, and its guru aggravates shleshma prakrut bala immunity, and growth stimulator factors are there. Even omega-3 fatty acid is there and easy to digest. Jatakarma Samskar is itself, we can start Swarna Bhasma, honey and ghee, but we need to ensure that honey must not be any such pak or any jaggery or jaggery mixed honey should not be there. And it should be very sterile one. So colostrum and breast milk difference, if we see that colostrum is very high and very rich in protein, fat, and carbohydrates as compared to breast milk. It's a very huge difference between colostrum and breast milk. So that's why it is called as piyush, and it should not be missed. It's the right of baby, and we need to give it properly. So rich in protein and also rich in vitamin A, sodium, chloride, immunoglobulins, but lower in potassium, and that's why we need to give vitamin K post birth, and fat and CHO, that is carbohydrate. We need to ensure that baby should not suck air or should not be, the latch must be very proper so that baby may not land up into infantile colic. We know that there are so many advantages of breastfeeding. Even it is economical, reduces allergic reactions, antibodies and anti-infectives are there, and it guards against different diseases and available even at natural calamities. Benefits of breast milk are so many. So especially it contains essential amino acids that like taurine, cysteine, and even high ratio of cysteine and methionine, and even polysaturated essential fatty acids are there. That's why better availability, bioavailability of iron and calcium also. It is little bit less iron is there in the breast milk, but still whatever it is iron is there, it is best bioavailable and it gets easily digestible. even vitamins, minerals, and electrolytes in right proportion, promotes emotional bonding, and so many other even better intelligence. There are so many benefits to mother also and family also, we all know. Then breast milk feeding, particularly there is a policy, a hospital policy must be there, so that every couple or every mother should get stimulated or motivated by such policy, and she can start her breast milk timely, breastfeeding timely. We can see with the help of breast feeding, we can see rooting, sucking, swallowing reflexes, then mechanism of prolactin and oxytocin hormones start as early as possible, so that there may be no any lack of breast milk. And if we suggest mother to put frequently on the breast, then no such deficient or lack of breast milk is there, and she can get very healthy bonding, emotional bonding also. So protection against infection, if mother is also little bit mildly infected or mildly having fever or minor problems or minor infection, then only she has to continue her breastfeeding, so that antibodies can transfer as a passive immunity to directly neonate and infant, and baby may get prevented from such infections. You can see here the difference between composition of preterm and full-term milk. Whenever we compare it preterm, we can see that as compared to full-term, fat proportion is same, but protein proportion is more in comparison to full-term and preterm. It's double as compared. Here is 1% is only there, per gram DL, it is just 1, but here a protein is doubled. So, and protein is the bodybuilding, so we can understand that in preterm phase, we need to give breast milk as early as possible to get the growth and development in the proper way. There are so many causes of not enough milk because of psychology, and we need to prohibit such prolactal feed, and don't give. We need to not to give start bottle feeding, which is very confusing one to neonate. Especially, it's easy to get feeding due to bottle, but neonate has to suck with efforts for breastfeeding. Express breast milk, particularly whenever a mother is in a sick condition, or very preterm baby is there, or ELBW is there, that is extensive low birth weight baby, or working mother, when mother is not available every time for her child. So she can express her breast milk and store it within freeze or outside at the room temperature also. And she can easily, as duty hours are not more than 8 hours, so she can store her breast milk at room temperature, and other members can feed the baby. Now coming to the infant feeding, we know that it's a rapid phase of growth and development, where we need to inculcate good eating habits and positive feelings about food and caregivers, triple their birth weight, because here there is a high growth spurt. And we can say that health is directly, food is equal to good and proper satmya food. Satmya ahar is directly equal to arogya or health. We can again this emphasis that ahar is mahaushad, that is great medicine. Here we need to emphasize, even government has also emphasized the infant and young child feeding. So government has started such act, and even IMS Act, that is such substitution should not be there, like formula feed and all. So we need to emphasize on prevention of protein energy malnutrition by giving the proper feed. And here important quotation is there, that pathe sati gadartasya kimoshad nishevane, apathe sati gadartasya kimoshad nishevane. Meaning, if we give proper pathyukta ahar, then no need of any medication. And if we are giving apathya, then there is, if so many medications are also, if we give, then there is also no use, because patient is taking apathya. So there is a great importance of Pathe in our day-to-day as a treatment principle in each and every disease treatment. We know that there are so many types of milk, breast milk. We can divide it into colostrum, transitional milk, mature milk, fore milk, and hind milk. Accordingly, we can give the guide to the mother. Then types of breast milk, hind milk, and all. So it especially there is a division that when to give, how to give. So we need to put, we have to suggest to every mother that she has to put both the breast to her baby, and even fore milk has its own importance as compared to hind milk. Hind milk is fat rich, while fore milk is protein rich. So both milk should be given, and if she is not available, she can give it as expressed milk. We can see the difference between fore milk and hind milk in detail in comparison in context to energy, fat, and other macronutrients. How often to breastfeed? This is a question many times primary, especially first mother is asking that baby is, if baby is passing 8 to 10 times urination and sleeping 15 to 20 hours and playful, active, then we can, and even weight gain is there around more than 25 gram per day. So we can consider the as a optimum breastfeeding is there, optimum supply of breastfeeding is there, because we cannot see how much breastfeeding is going on, how much milk is baby is sucking. So we need to just take approximate just inculcation that how much baby is urinate and sleeping or active. We can take the guess of proper breastfeeding or not. Schedule of feeding and duration, particularly exclusive demand feeding is there, EDF. Gradually the time on increase so that the baby gets both fore milk and hind milk. And if mother is ill, we can directly give express breast milk or directly formula feed. And even if mother is ill, particularly in malignancy or AIDS or psychosis or thyroid problem, then it is a clear-cut contraindication of breastfeeding. Here we can see the low birth weight or small for dead baby. We need to feed early. We need to give it timely and of express breast milk after 3 to 4 days. And it should be supplemented with properly fortified formula. Or we can give supplement of vitamins or multivitamins. And we can start with cup and spoon or pallidi. If baby is very low birth weight or less than 1200 gram, that is extensively low birth weight. And if preterm condition like less than 30 weeks or during first 3 days, or in disease condition like respiratory distress or sepsis, seizures, then parenteral intravenous infusion is mandatory. Because in all such conditions, Amavastha is so much. So we need to give, we need not to give any breast milk. Rather, we need to continue parenteral feed only, parenteral IVF only. Nasogastric gavage feeding, in some conditions we can give, particularly when baby is LBW or stable infant, but inability to feed due to neurological illness. In such conditions, we can give gavage feeding or cup and spoon pallidi feeding and avoid bottle, because it misleads baby to get the breastfeeding due to easy nipple, easy bottle nipple. Tropic feeds we can give when baby is on IV fluids, and even we can give start for the priming of gut. What is priming? Priming meaning here we can give the small just one sip like breast milk, so that the gut can be matured slowly as it as gut breast milk enters to the gut. So priming will be there, and baby can get easily digest the breast milk and absorb it properly. So gradually increase quantity according to tolerance, and 1 to 2 ml express breast milk we can give every 2 hours for 24 hours with IV fluids. So human milk fortifiers when to give, particularly less than 34 weeks age is there, preterm condition is there, and 1-2 gram sachet of 50 ml express breast milk we can give, which is a multivitamins, or we can say as a fortification. Delayed enteral feeding when baby is in disease condition. Modes of tube feeding, particularly gavas feeding, gastro when another modes when we can directly give by gastrostomy, by nasovaginal way or gastrojejunal way, and continuous intermittent bolus methods, we can give orogastric or nasogastric also. Types of feeding or enteral or parenteral. Enteral, particularly when we can give pasteurized donor human milk also, and avoid mucosal thinning and villi flattening. If we are not providing timely breast milk, then it may happen that mucosal thinning will be there and villi gets flattened of duodenum and all in small intestine. So for that prevention of flattening or thinning, we need to give little bit enteral along with enteral. Means enteral is from gut only, and parenteral is with parenteral means only IV. We know that enteral is low cost, supplies hormones, and it has so many good features. Avoid aflatoxin is important, and parenteral is particularly high risk baby, only for high risk babies. We can directly, as per age and weight of the baby, we have to start IVF, which is very essential for proper growth and development and generating immunity. Animal milk versus breast milk, we know the difference that breast milk is superior than all other animal milk. Comparison of breast milk and cow milk, we can see that cow milk has so much more components as compared to breast milk, which is not so good because the baby is directly getting so much micronutrients, which is not properly digestible. So as compared to cow milk, breast milk is always safe. Disadvantages of cow's milk, particularly in terms of phosphates, very high in such a quantity, and that may leads to hypocalcemia and hypomagnesemia. So may lead to neonatal convulsions also. So we need to ensure that whenever mother is giving cow's milk, she has to dilute it properly. Artificial feeding is whenever there is a very utmost condition is required, then only we need to give artificial feeding. Rather, artificial feeding, we need to ensure that we can give pasteurized human milk, like from breast milk bank, we can give directly as compared to artificial feeding. So all these such formula feed are inferior than pasteurized human milk, breast milk bank from that bank. Infant formula, along with it's a blend of vegetable oils and fat source, lactose, and so many vitamin mineral mix, so that baby's growth and development is getting proper. But infant formula, instead of infant formula, we need to rely on our daily diet. So whenever such disease condition is there, then only we have to give infant formula milk. Otherwise, we need to give pasteurized human milk from bank. Nutraceuticals, we should not rely on nutraceuticals. Rather, we need to give more emphasis on our day-to-day diet, which is mother is preparing at home. And they are, instead of relying on purchase, she can start at her home with all such khichdi or dalia or like that. And very soft from liquid, then semi-solid and solid. In that way, she can get priming of gut and accordingly increase the diet and quantity. Adverse effects of artificial formula feed is malnutrition, contamination, high sodium content, which may leads to hypernatremia with high LDL, which is very bad, and even iron deficiency may be there, and even behavioral and cognitive delay is there. So weaning and complementary feeding, we need to start timely. And don't delay in weaning, because when to start, many times in India there is a high rate of PM because of delayed weaning only. So whenever infant is munching, like chewing repeatedly, use of teeth, then it indicates that baby is ready, biologically ready to accept semi-solid food at 6 months. So this is the warning sign that give me diet or give me little bit soft food, soft diet. So this is the demand of child, but we mainly many mothers ignore it, and they are continue with breast milk only, and they delay the weaning, and baby later on may land up into malnutrition, particularly protein energy malnutrition. So we need to consider the frequency and energy density as per need of the baby. If energy density or amount of food is low, then we can increase the frequency. As per the this age of the baby, we need to divide the amount of food accordingly. Technical, whenever there is a baby is in suffering with so many other disease conditions, we need to change and modify the diet to get the proper immunity. Like low, whenever biliary atresia is there, we can reduce the low LCT, that is MCT or LCT, as a because fat is not fat digestion is mainly depend on bile. And when there is atresia, that is completely biliary atresia is a condition which is absence of bile, we can say. And in such conditions, fat should be prohibited and it should be low at least. And then when RDS or CHD or LRTI, recurrent lower respiratory tract infections are there, so we need to increase the nutrient drains formula, because child requires that means demand is high, and high energy is required. So we need to reduce the sodium restriction, because of there is a fluid congestion is there. So we need to change the modified diet accordingly the disease condition, so that baby can easily get the nutrients from macro and micronutrients both. Yeah, in VLBW or SFD or preterm conditions, we can give F75 and F100 or fortified sachets of multivitamins. Medicated oil massage of baby or balguti, which is very important concept, but nowadays it is lacking and no one is giving balguti, by the misconception that even pediatricians are directly recommending that don't give balguti, don't put kajal, don't put any abhyanga or any massage, don't put oil in nostrils. And our healthy routine and as a dincharya part, they are directly prohibiting, and they are against all such traditional ways of dealing with neonates and infants. But the main, we need to understand the scientific reason that balguti may harm to the child if it is not properly tackled and not kept properly as hygienated. So whenever we are giving, we are suggesting mother to give balguti, we need to ensure that mother is giving sun exposure to that all ingredients, so that fungus should not grow and baby remain safe and healthy. So we need to ensure this, mainly one reason, which is the hurdle of giving it, and pediatricians are prohibiting it or denying it not to give. If we take care, the important concept of balguti as a fungus leading thing, if we ensure that no fungus will be there due to that weight apply, we are suggesting mother to give it from breast milk, and she's giving such friction of all ingredients components with breast milk, and she's putting back to the container as a weight only, and she's closing the lid, which is harmful and may lead to fungus. So we need to understand that concept. And if we properly convince mother, every mother, that why she has to give sun exposure to remain it from fungus free, then no such prohibition or no such denial is there regarding balguti. We can give, if a baby is LBW, we can suggest matra basti of breast milk, even instead, because the mother low birth weight baby is not able to suck the breastfeed breast sucking because of low energy. we can give Matrabasti to such low birth weight baby or VLBW or ELBW baby. I just slowly, just 1 ml, 2 ml, 3 ml, in like that way, along with ghee, which is directly one drop only. We can give it with Matrabasti, so just few ml of 1-2 ml of from 2 ml in ELBW particularly, I am saying. And as per the age progresses on, we need to increase the quantity of Matrabasti and along with ghee also. If we are directly giving it very slowly, then no such any harm or nothing is there. Rather, we can increase the weight at most properly, and no such parental dependency is there. Even IMS, that is infant milk substitutes, we should give it when baby is not in a position to suck breastfeed. So 150 to 175 ml per kg per day we need to give. As per the condition, it is not for in very neonatal condition, but as per the age progresses on, as per the maturity, we can give it increase or decrease as per need. So formula feed, particularly 1 level scoop powder and 30 ml water, mix it properly and then slowly we can give it. Avoid bottle feeding, which is confusing with nipple. And traditional spices we can add like in diet, soft diet, hing, cumin, garlic, ginger and haldi. By 1 year of age, baby should eat everything cooked at home. Surnaprashan, we should start, we need to ensure that no such contamination is there, or all ingredients are very hygienic and sterile way, and we are mixing it properly. So if baby is like after 6 months, we can give directly Surnaprashan, but before ELB in LBW or ELBW or VLBW, we should avoid Surnaprashan because it may lead to NEC, that is necrotizing enterocolitis, or maybe land up to botulism. So we should not give in such conditions Surnaprashan, but we can give it in 1 year old onwards children. Balanced diet, we need to ensure that there is a balanced diet more than 6 months, 800 ml per day. And accordingly to the age of the baby, we need to increase 50 kilocalorie per day per kg. Even we can start Balaguti and Surnaprashan and Abhyang also, which is also giving good portion or Bruin strategy. Immunization timely and start weaning properly so that all Rasatmak, Rasatmak Ahar should be inculcated since the infancy. We should not give overfeeding also. We may end up into diarrhea or spitting up or gases, or even land up into the obesity. We should not also give underfeeding also, because underfeeding is also leading to Karashya, which is a protein energy malnutrition condition, and failure to thrive condition. So we need to ensure both things, avoid overfeeding also and underfeeding also. If baby infant is having tongue tie, like if tongue tie is there, you can see here the tongue tie is there. So in such cases, we need to do frenuloplasty, and then only the proper latch is there of mouth and breast. Then if a baby is suffering with cleft lip or cleft palate, we have to use long spoon or a long dropper so that easily they can get feeding directly in the directly hypopharynx. They can directly, instead of, because palate and lip both are simultaneously cracked, so that it gets very much difficulty in suction also, and in latch or sucking or getting feed inside. So long dropper is always helpful, or even long spoon. Time commencement, we need to remain cautious about energy requirement as per age going on. Stanyapan weaning, we should think properly that whenever baby is crossing 10 months old or onwards, we need to avoid whole nuts or ground nut or whole grapes or raw carrot. It may choke the condition. It may choke esophagus, or it may go to trachea also. So or baby may directly put anywhere. So we need to avoid such foods items giving directly to the baby. So ensure that no early weaning or no late weaning also, but timely weaning is important for the proper growth and development and immunity also. So toddler nutrition is also important. We need to ensure that as per age growing on, or 1 to 3 years, because this age is so much hyperactive condition in this age, and babies, whatever quantity of diet baby is taking, directly neutralizing it with so much fun and so much activities. So we need to ensure that baby must get proper diet, and that healthy habits inculcation is also in this period only we need to inculcate good habits. And we need to we should not give frequent juices, or limited the bakery items or sweetened beverages or dairy products. We should not give, rather, and we should not also recommend every time multivitamins. Rather, we need to give the proper diet, whatever cooking is there at home. Mother has to feed her baby whatever is directly ready in the home. And if there is a need or in deficiency condition, she should give supplement of vitamin D, calcium, and iron, which is very most important for proper growth and development and immunity. Energy requirement, if we want to check that whether 12 months old girl is getting proper calories or not, then we can, this is the formula, that 89 into birth weight, total body weight minus 100 plus 20 kilocalorie for energy deposition. And here we can see the formula and total output of kilocalorie energy needs. Even we need to ensure that proper intake of macronutrients, protein, then micronutrients also, calcium, iron, in a proper amount. Role of vitamin and minerals, in this way we can ensure that all macronutrients are getting in the food, in the plate of baby, and babies getting all such macronutrients. Preschool children requirement is little bit more than toddler. So we need to ensure that iron must be 7 mg per day. Baby must be taking, and zinc 3 mg per day, calcium 500 mg per day. Fruits, particularly she should give, and veggies also, grains, full grains, and fiber also. So if we talk about Ayurveda approach, like asamyak ahar, what should not be given? We are talking about what to give. But here now I'm discussing that asamyak ahar is also very much need to ensure that baby should not take asamyak ahar, which meaning sugary drinks or soft drinks or bakery items or guru abhishandi, vishtambi, vidahi, shoshan, or shodhan kind of rakta mokshan. So much panchakarma should not be there. Or in particularly such a disease condition, we should not give any amaj or abhishandi or such ahar which may land up into more amavastha. In Sastra Yoga, Prakara Yogas are mentioned, which are very important for aspect of immunity, building immunity, which gives therapeutic and nutritive purpose, promote growth and development and immunity. In all nutritional disorders like Fakka or Karshya or Balashosh, where we can give Prakara Yoga, which increases immunity and ensures proper growth and development. Safe complementary food is equally important, like Shali, Shashti, Godum, Yava, and Leha, Vidanga, Kodrav, Priyal, Majja, and Bilvadi Modak, Dhatki Pushpadi Modak, or fruits, or Manuka, Anjeer, or Penkajur, dates, or so many things we can give directly by soaking it, or by taking out from the mixer and as a semi-solid diet. As per the age, we can start complementary food as a liquid, then semi-solid, and then solid. Safe complementary foods, again, we have to add ghee, little bit, curd as a prebiotic or probiotic, and then particularly protein content must be there, as a yush, moong dal particularly is more good than any other pulses. We can improve the nutritive value by soaking, by malting, by sprouting. So Ayurveda concept of immunity is particularly dosh dhatu, satna, ojovardhak or balavriddhikar, Vedic shamatva are the main important concept of immunity. We need to ensure that we can give, because ahara is mahoshad. So the nutritive value, nutritional immunity, we can mainly thinking, and today's topic is mainly nutritional based immunity. So we need to ensure that whatever mother is giving, we can enhance, we can improve, augment such nutritive value by soaking, malting, and sprouting. The role of food to boost immunity, particularly we have to supply certain kind of micronutrients, selenium, folate, iron, copper, zinc, and which are erythropoietic elements we need to boost asti bone health also, and iron, RBC or erythropoiesis also. And we need to ensure prebiotics or probiotics, which are mainly like banana or buttermilk or like garlic. These are the examples of probiotics, and gut macrobiota, which is very important in terms of building immunity. Omega-3 fatty acids, or as a complex carb, we have to ensure ragi and other millets also in time to time. Even in such neuromuscular disorders, CNS infections or metabolic diseases, we have to ensure high fat diet, which is called as keto diet. So that baby may rely on high fat instead of low carbs to produce ketosis. Impact of immunocompromised state. Undernutrition leads to poor immunity, increased susceptibility to infections, and poor outcome. So immunosenescence is likely to contribute to the increased susceptibility of infections such as influenza and pneumonia. So increase in prevalence of cancer and ISD, decrease in innate immunity response, and hamper the maturation of T cells and NK, that is natural killer cells, and macrophages, which are the mainly immunity building things in our body. When we are just, there are so many autoimmune diseases, or where AIDS-like condition where immunity is very low. So in such condition, we need to ensure that no such live vaccination must be there, but rather killed and attenuated vaccination must be there. Like instead of OPV, we need to ensure IPV only. If we give proper nutrients like vitamin A, B6, B12, vitamin C, copper, vitamin D, nowadays vitamin B12 and vitamin D are commonest deficient micronutrients. So we need to ensure these supplements also to get the proper growth and development and proper immunity to prevent all kinds of common ailments. These are the food items in which iron, selenium, all such micronutrients are morely dense. Nutrient supplements and immune function. Mainly dietary intake of micronutrients are much beneficial than supplements for strong immunity. So need of the hour not to rely on nutraceuticals, but on healthy diet only. Instead of purchasing all such nutraceuticals and multivitamins and all other things as a medicine or nutraceuticals, we have to ensure that quality and proper diet must be there to get the proper immunity and prevention of all such common ailments. We need to ensure that right food as per dietary guidelines, which is directly needful to boost immunity. Breakfast is must. Many times children are mainly in the haste of sending them to school at proper time. Mothers are skipping their breakfast, which is very unethical. We need to ensure that breakfast must be added, which is very rich in nutrients and timely. Such 4 to 5 servings are essential in 24 hours. And like that, we can divide. First, ghee is must daily to boost your gut, particularly brain health, and spinach or pomegranate nitrates or alkaline diet, we can say, we have to ensure. And evening seeds, nuts, fruits, groundnuts must be added in the serving. And at dinner, it should not be late than 8 p.m. And then we need to give, we have to suggest mothers or parents to give warm turmeric milk as a golden milk at bedtime to prevent all kinds of respiratory infections. Acidic food versus alkali food. Again, this is a common debate point that acidic food is particularly spicy diet, chili, fried, fast food, or garam masala like oily or fried items, and fast food also. All these such food items are acidic in nature. And if we talk about alkalinity, alkaline juice or veg fruits or dates, nuts, seeds, jaggeries, sprouts, all are the mainly are alkaline in nature, which are very good to our gut. Mainly rules to consume water also, we need to ensure that more water, like every time there is a in social media also we can see that more emphasis has been given on hydration. It is good, but if we are giving more consumption of water, we are giving them more hydration as more than their need, then what will happen? They may land up into the like Agnimanda particularly and Amavasta. Because water has also, Nana always says that Panalai Pachawa lagta. I remember that this sentence of Nana that every time if we emphasis on directly hydration, more hydration, it is directly burdening on our kidney, which is not good. So we have to keep balance of Ati Sarvatra Varjayat. It is always is a common saying that we should not give Ati should not be given. So proper amount of hydration is okay and should be maintained. Then instead of freeze water, we have to ensure that earthen pot water is very good. And even if we have to ensure the prevention of common ailments, we can add certain kinds of herbs in water like jeera, cumin water, or ginger water, or like tulsi water, or even haldi, or even so many things we can add, dalchini or tejpan, or so many things we can add in water. We have to not to boil, but we can keep it soaking, and beside it, even as a like dhania, we can say, put in the water, and that coriander we can water can be given to the child, which is child, if child is having pitta vriddhi or some vidagdha pitta. Ice cream is we already know that ice cream is pitta, is ushna in nature and ushna viryatmak. So it may give you the full effect, but it is not so good to take consume every time ice cream, and recommend them, because it contains certain kinds of chemicals also which are not good. And patient may get baby may get GERD or acidity or poor digestion if baby is gulping water in a large quantity. So that hyponatremia or any kind of such conditions should not be there, and we have to explain the rule of water consumptions. If we talk about gut microbiota and pre and probiotics, which is essential for to look out the building of immunity. Then malnutrition and immunity dysfunction, particularly in such conditions, in all such conditions like lifestyle disorders, we have to ensure that immunity should be maintained with the help of not under nutrition should be there, or not over nutrition should be there. Nutritional lifestyle factors we need to ensure, and no weight dharan or stress or workaholism or missing the food or timings. Such things should not be happen. Role of vegetables and fruits, we all know, like that it contains so much antioxidants and good micronutrients. And even we have to ensure that anti-nutrients, which are not good if baby child is taking so many tea, like tannins, which is directly as an anti-nutrient to other absorb to get the proper absorption of other food items. So it is prohibiting to get absorbed it timely. So such anti-nutrients should be avoided, like phytates, tannins, caffeine, oxalates, and xenobiotics. Daily food guide should be explained to every mother so that she has to give the proper balanced diet. Health and good immunity markers, like when to give, when baby is getting desire for food or proper digestion, proper evacuation of feces, lightness of body, sound sleep, normal awakening, proper strength, complexion, life, which indicates that baby is having good immunity. Instead of checking it every time as a marker or as a CBC again and again, we can ensure as a phenotypic sign and symptoms by asking them to mother particularly. There is a wide discussion of ahar in all Samhitas, and mainly we have already discussed that Kashyap has explained it as a Mahabhaishajya, and even Panchbhotik ahar is explained in our Samhita. And mainly there are so many rules for taking like Matra are, and how much like parts of stomach should be there, and okay, you will not get any trouble. Is it clear now? Okay. It's not moving. Oh, okay. So there are so many viruddhas are described in our Samhita, like Pramitashan, Samashan, Vishamashan, Vishtarjirna, different types of Ajirna, or Asatmya Hatidrava, Tishita, Prajagar, Diva, Sapna, Apatya. Even these are the healthy diet versus unhealthy diet. There is a wide discussion that what to eat, what not to eat. And as per the weakness of the body parts, we can recommend Is it visible? Hello, sir.
Yes, ma'am. Visible.
So there are certain kinds of healthy diet and unhealthy diet description, and even we can emphasis on particular diet if patient is having weakness of particular part, like even in CNS disorder, we can ensure that patient must get walnuts, and in vitamin A deficiency, eggs or cabbage or milk. In particularly bone health, we can give sesame or milk, so that if there are so many examples of part wise, if any body part is weak, we have to ensure the proper diet so that like Mahoshad, it can boost the proper immunity of that particular organ. These are the Ahar Vidhi Visheshtayan, Ushna, Jirna Ahar, Viruddha or Ishita Desh, or without talking, without laughing, without, so many rules and regulations are there. And even wounds are said that Ushna Snigdha Ahar must be there, Matra Yukta Ahar must be there. When body gets hunger, then only Jirnahar and then Ahar should be consumed. Then these are the Ashtavidhi Visheshtayan like Prakriti, Karan, Sanyog, Rashi, Desh, Kal, Upyukta and Upayog Samstha. So these are the 8 Ahara Vidhi Visheshtayan, and as per the age of the baby in school age children, we have to ensure that proper Shadasatmak Ahara and balanced diet must be received to every child. So these are the balanced diet, and things should be added as per the calories and as per the all Shadasatmak and all including all rules of diet. Vitamins and minerals supplements, Ahar Vargas must be added, like all Shadasatmak Ahar, including proteins, carbs, and fats and minerals, fruits, and everything. So these Ahar Vargas are there. All Acharyas have described it very detailed way. All Vargas and all Upyukta ingredients and Shadasatmak, importance of Shadasatmak Ahar. And Rasayan particularly, like Kamya Rasayan, Naimittik Ahar Rasayan, Naimittik Rasayan, based on disease condition and based on method to use, like Vata Tapik or Kuti Praveshik or Ahar Rasayan, Achar Rasayan. We have to consider to boost the immunity in preschool children as well as school going children. So should not miss the meals or breakfast particularly. And feeding related problems or any like forceful feeding or war time, such thing should not be there. Baby must get proper hunger, so the baby must get proper exercise also, so that naturally baby should get hunger. So World Nutrition Day is 1 to 7 September, and we should everyone should follow it to aware, because our responsibility to aware society also. So we have to aware society regarding proper consumption of food and Poshak Ahar. So food guides, balanced diet, and a total quantity of particularly male adolescent child should get 2400 kilocalorie and female should get 2100 kilocalorie. Adolescent nutrition must be there because this is a shifting of hormones and getting more directly adulthood. So instead of so much likings and dislikings, we need to, if we inculcate good habits since childhood age, there must not be any problem in dealing with adolescent nutrition issues like missing meals or likings and dislikings. So Dosh Viruddha, Sanskar Viruddha Ahar, Agni Viruddha Ahar, Satma Viruddha Ahar, Koshta Viruddha Ahar, Virya Viruddha Ahar, and Krama Viruddha Ahar, Parihar Upchar Viruddha, or Sanyog Viruddha, Pak Viruddha, Avastha Viruddha, Vidhi Viruddha. There are so many Viruddhas are already described by Acharya Charak particularly. And so we should avoid them because they are directly creating certain kinds of harm and toxins in our body, which are very harmful in creating disease condition and depleting the immunity. So we need to give such kind of ahar which is increasing the immunity. So patyahar like cereals, pulses, fruits, vegetables, and lifestyle should be including exercise or PT like simple exercises or yoga. So apatya we have already discussed. Principles of healthy eating campaign like moderation of in all things, variety is the spice of life. We need to give them variety of food and should not force them. Enough is enough. So one man's meat is another man's poison. So we need to ensure the because Ayurveda is individualized science. Not one thing is not fit for everyone. So we need to ensure the Prakriti and all other factors like Agni, Koshta, and all other things to get the proper quantity of ahar instead of relying on calories. So conclusion and take-home message is to feed the baby is an art, requires patience. Keep hygiene and adequacy of protein-rich food and hydration. Entertainment and feed is okay, but not with mobile or any gadgets. Nowadays, it's a trend that every mother is feeding her baby or child with TV or with mobile or with video games or all gadgets. So this is just deviating to the focus on diet and getting them so much radiation and other issues of neck and posture and eyes also and brain also. So don't start early or late winning, but timely winning is the key of good health. Diet is a great medicine, is Mahoshad. Balanced diet, which is an immunity booster, and increased foods insecurity, a big concern. So we have to ensure organic food rather relying on pasteurized and contaminated diet. Prevention of morbidity and mortality, which is particularly key health. And in this way, we have discussed fetal nutrition to neonate and infant, then toddler, then preschool, school, and adolescent, child age, all age groups, nutrition and immunity boost. How can we how can we prevent such ailments with the help of diet-based immunity? Thank you all for giving me this opportunity to give you this talk. Thank you, one and all.
आज का आभार प्रदर्शन वैद्य नितिन मेशकर सर करेंगे।
थैंक यू मैडम, आपने जो इतने कम समय में इतना बड़ा जो आहार के बारे में बताया, उसके लिए गुरुकुल परिवार की तरफ से मैं आपका अत्यंत आभारी हूँ। आपने जो बताया मैडम कि स्तन्य का महत्व, आयुर्वेद में स्तन्य का महत्व है ही, लेकिन आहार जो बताया है कि बालक के जन्म होने से पहले ही कम महीने से प्रथम मास में हमारे गर्भिणी के आहार का वर्णन किया, वहीं से बालक के आहार की शुरुआत होती है, ऐसा मुझे लगता है। हम लोग देखते हैं कि माता का स्तन्य ये बहुत ही उपयोगी है बालक के लिए, उसके इम्यूनिटी के लिए, उसके बढ़ने के लिए। आजकल हम देखते हैं क्लिनिक में माँ पिताजी के साथ बालक आते हैं और माताएं कहती कि भाई हमारा बालक कुछ खाता नहीं, इसकी तबीयत बार बार खराब होती है, और बालक के हाथ में रहता है अलग अलग प्रकार के पैकेट, और बड़े गर्व के साथ कहती हैं कि भाई ये मेरा बेटा तो 3 बार ये इसको चिप्स खा ही लेता है, चॉकलेट के सिवा तो इसका होता ही नहीं। तो यह हमको भी सोच, माताओं की सोच को बदलना पड़ेगा। माताओं ने भी और बहनों ने भी जो हमारी जो बालक के लिए घर में बनाने की जो विधि थी वो सब भूल गए, और आजकल सब वो सेरेलैक्स और कुछ कुछ नई नई चीज़ों का प्रयोग वो करते हैं।
Yes.
तो आपने जो बताया बहुत ही महत्वपूर्ण मार्गदर्शन हमको किया है, इसलिए मैं गुरुकुल की तरफ से आपका आभारी हूँ, और जो भी लोग आज ज्वाइन हुए हैं उन सभी का आभारी हूँ, और भविष्य में भी आपसे ऐसे ही मार्गदर्शन की उम्मीद करते हैं। धन्यवाद।
Thank you all.